Hi, and thanks for registering for my Medicare webinar. This is actually a replay of my live event done in Thomasville, Georgia in August of 2022. So it's new and relevant information for you. I hope you enjoy, and there'll be a message for you.
So the initial enrollment period, by the way, is 3 months before you turn 65, the month of your 65th birthday, and 3 months after that. So you actually get a 7-month enrollment window for Medicare. You're not going to have to worry about it if you are on Social Security. It's going to happen automatically. There's that 7 months, 3 months before, 3 months after, and the month itself. So what if I'm still working? That's the next scenario. So if you're not taking Social Security because you're putting it off, right, and instead you're continuing to work past 65, okay, great. There are 2 ways this can go. It's either you have an employer with 20 plus employees who is providing you health insurance, and if that's the case, then you can opt out of Part B. And the way you would do that, and the reason you would do that, is because once you get on Part B, it's going to cost you $170.10 per month. And if you have an employer plan that's already covering you past 65, then there's no sense in paying the $170.10. Might as well save that, right? So if to do that, when you receive your Medicare card in the mail, you would just, there's a place to say, I just want A only, and you send the card back. And then they'll send you a new card that just shows A on your card. That's how that would work. If you have an employer that has 20 employees or less, then that's a different situation. You would need to drop the employer plan, take A and B, and then you'd want to add a Medicare plan that replaces your employer plan. Is anybody in this situation that has an employer of less than 20 employees who's going to be working past 65? No? Yeah. You do? Okay. All right. So you're working past 65, less than 20 employees, then you're likely going to take A and B and drop the employer plan, and then you're going to want something to replace the employer plan, so you want a Medicare plan of some kind. We'll go over the 2 basic kinds that there are today, and then we can speak further one-on-one if you'd like more guidance regarding that. Now, this is important. If you were up here, right, and you had the 20 plus employee situation, you decided, I'm not going to take B. Well, when you did decide to leave work, you're going to have 63 days to get on B and get a new plan without any health questions. So that's the scenario there. All right, so let's get into the real nuts and bolts of it, guys. This is what you came here for. This is the real nuts and bolts of Medicare, how it works. This is what I call government issued original Medicare. This is just what you get from the government. It's government issued. So A, here is how I remember what A covers. The A kind of looks like a roof, right? Roof, hospital. So A covers a hospital. That's how I remember what A is. So one of my old teachers taught me that as well. So A is going to cover your hospital stays, skilled nursing facilities, hospice, home health, things like that. A doesn't have a monthly cost. The nice thing about A is you actually paid for A through your payroll taxes and so forth. And you see that Medicare line on your taxes taken out for all those years you worked. So if you worked at least 10 years, then you have no monthly cost for Part A. Or if your spouse worked at least 10 years, then you have no monthly cost for A.
You said 10 years?
10 years. If you worked for 10 years on a payroll where the taxes were taken out, then that's the case. Or your spouse. Okay?
I have a question.
Please.
10 years would be effective when you're signing up for the budgets, correct?
Correct.
10 years prior.
That is correct. Ready?
10 years, 5 years ago.
At any 10-year period cumulatively at the point that you're making the enrollment.
Okay.
Yes. So that's it doesn't have to be 10 years consecutive, any 10 years. over time. Yes. Part A doesn't have a monthly cost, but Part A does have a deductible cost, right? This deductible cost is $1,556 per hospital visit. Now guys, this is a little unique. Most deductibles that you deal with in your insurance life are an annual thing. It's like when you meet the certain deductible, you've met it for the year, and then you don't have anything beyond that. That's not the case in this scenario with A. This $1,556 is not for the year. This is per hospital visit. So every time you get admitted to the hospital, you pay $1,556 every time, unless the only exception is you were in the last 60 days. If you were there in the hospital in the last 60 days, they don't charge you again. But if it's been 60 days plus, then you pay another $1,556 for that. Okay? We'll talk more about that in a bit, please.
That doesn't include emergency. That's for emergency.
If you go to the emergency room and are not admitted to the hospital, that is a different scenario. All we're talking about right now is hospital admission. If you are admitted to the hospital, you are going to be you're going to owe that if you don't have a plan of some sort in place. Because again, remember what we're talking about here to the talker. Remember what we're talking about here is original government issued Medicare. Okay, so this is without some sort of plan. Most of you are going to elect to put some sort of plan in place, most likely, that would then absorb or help cover that. And that's part of the reason why people will put a plan in place is that cost plus others, as we'll see.
That's the supplemental?
Either plan will help absorb that. I'll talk about that more.
Okay.
But yes, supplemental, advantage plan, both have their different way of covering that. And we'll talk about how they do it differently.
Cool.
Okay? Part B. So unlike Part A, which did not have a monthly cost, Part B does have a monthly cost. How much is that monthly cost? As this young lady right here pointed out, that Part B monthly cost is $170.10 a month. $170.10 is your Part B. Now, they're typically going to take that, well, if you started Social Security, they are going to take that from your Social Security check. They're going to deduct that from you. If you have not started Social Security, you decide to put it off, fine, then you're still going to have to pay them $170.10. You're just going to have to pay them direct instead of from Social Security. They'll give you your payment options for that. But that's owed. In addition, like over here you have a deductible, over here you have a deductible. This one is for the year. So Part B's deductible is $233 for the year. So all that means is and Part B covers doctors, A covered hospital, B covers doctors. Right? That's what Part B is. Outpatient care, occupational, physical. So all your doctors, by the way, including your primary care and your specialists. So you pay the first $233 of the year for any of your doctor visits. After that, on standard Medicare, you pay 80% of the bill after that. Now, here's what's a little concerning, though, for most folks, as it should be. You're on the hook for 20%, and there's no cap on the 20%. So without some sort of plan in place, that 20% can go astronomical. So if you have a heart procedure or some transplant or something done, and God forbid, and the doctor bill alone was $100,000, which can happen, then Medicare would pay 80%, you would be responsible of 20%, which is what? 20 grand. So not a lot of us have 20 grand laying around. That can lead to bankruptcy. In fact, these costs are a leading contributor to bankruptcy in the U.S. for those that go bankrupt. This is another reason why people will add a plan of some sort. Most people don't like the uncertainty of that 20% just hanging out there. So that's another reason why people add a plan, that it would help. So staying with standard Medicare with no insurance plan, this is still government issue. Just to recap, your monthly payment for A, $0. Your Part A deductible is $1,556. By the way, a little trick to remember with deductible. What is deductible? Deductible is the amount of money I have to deduct from my pocket before the plan pays anything. That's how I remember what deductible is for that term. So, hospital stays, this is a breakdown on this. So listen, if you're in for 60 days, you're good. Under standard with no insurance. Medicare's got you after that 1556 for 60 days. If you happen to have to be there for 61 to 90 days, you're on the hook for $389 a day. If you have to be there after 91 days, you're on the hook for $778 a day. If you have to be there after 150 days, you're on your own. Because of the full load. Similarly, skilled nursing. Medicare's got you for the first 20 days. After 20 days, you're on the hook for about $200 a day till 100, at which point you're on your own. So this is another reason in red people will typically not want to just stay with standard Medicare, government Medicare. They want some sort of plan that accompanies it that would absorb, or help absorb these. Part B, just to recap, $170.10 a month, unless you have a higher or lower income. We'll dip into that a little bit. Part B deductible $233, Medicare is $80, you pay $20. 20% can be unlimited. There is no cap on that. Next, D. Part D, easy to remember. D stands for drugs. D stands for drugs. There's no way you cannot in the future remember what Part D is for. This is the easiest one they've done. I wish they made them all this simple. Now here's what's tricky about Part D, folks. The government does not provide you with Part D, as my gentleman friend Ross here learned through a friend of his. Part D is not provided by Medicare, but Part D is required. Part D is required. If you do not get Part D during that 7-month open enrollment window I pointed out to you, then you are going to have a late enrollment penalty. It will be assessed for every month that you should have had Part D and were eligible but did not. It will then be added to your monthly payment, and that is for life. That is for life. So, unless you have some special exception, which I'm not going to get into, then that's it. That's the situation for your life. Now, how do you get Part D? This usually happens in one of two main ways. Do I have any retired veterans here? No. Okay. Veterans, some veterans are on a different situation. That doesn't apply here. You're either going to get a standalone prescription drug plan, which costs anywhere from $7 a month to $40 plus, depending on the number of drugs you're taking and the complications of them, how severe they are, how complicated they are. So you have a deductible of $480 a year for that. And that's the same, also, the second way you get it. Before I get that, look at that, let me back up. So way one is through a standalone prescription drug plan. Way two is it's bundled into a Medicare Advantage plan. So those are the two ways. You either just add it on to your supplemental plan, which we'll talk about, or it comes in with your Medicare Advantage plan. Either way, there's a $480 deductible. That's set by Medicare, just like all these other deductibles we're talking about. So this $480 a year is your deductible. You pay the first $480 before the plan pays anything. However, they do give you a break on the prescription drug situation. Most of the drugs you folks are going to take are going to be what's called Tier 1 and Tier 2 drugs. Lisinopril, all your basic stuff, and cholesterol, that stuff. That's Tier 1, Tier 2 stuff. And that's not going to require you to get into that $480 in order to get them. They're going to be super inexpensive. So if you have more expensive related drugs that are on like Tier 3, Tier 4, Tier 5, then you will be required to start dipping into that $480 before the plan's going to kick in. All right? Drug plans have these tiers. I'm not going to get into it today. They've got these different stages, I should say. They've got these different stages during the plan. If you go up to a certain amount, then you get into a different stage. If you spend up to a certain amount after that, you're in a different stage. All I want to point out to you here is the final stage for the year is called the catastrophic stage. And even in the catastrophic stage, you are responsible for 5% of the cost of the drug, and there is no cap on that. So there's never a point at which you don't owe something for your drugs. We'll cover that later in the cancer scenario. If you're on the hook for 5% of the cancer drugs, even in this catastrophic phase, that could be a ton, please.
Is that per year?
This is every year, starts over January 1.
Okay.
Every year. Starts over January 1, resets January 1. So, if you have lower income, related to the prescription drugs, okay? If you have lower income, meaning specifically, if you're single and you make less than 20 grand a year, or if you're married and make less than 27.5, then you probably qualify for extra help. What does extra help give you? Extra help gives you help on your prescription drug costs, both the monthly payment and the actual cost of the drugs themselves. And if you're on some expensive drugs, that can be a ton of money. That can be a ton of savings. A lot of people don't even know this exists. This is free money out on the table for people under this threshold. A lot of them don't even know it's out there. I've helped so many people get on this that didn't know it was there. So they do have an asset limit like Medicaid does, but be mindful of this. People miss this. Your asset limit is set to 15 for a single, 15.5 or 31 for a couple, but doesn't include your house, your car, because a lot of people mistakenly say, well, my house is worth more than this. I know I don't qualify. No, your personal residence doesn't count towards your asset limit. If you had a rental property, it would, but your personal house doesn't. Yes, ma'am.
Is that what you call the QMB program at the state?
That's correct. It does get into the QMB stuff. There are different levels you can qualify for here.
But there are other programs besides the QMB you can?
Mainly Medicaid,
Okay.
which we're going to talk about next. Thank you for bringing me into that. By the way, to apply for extra help, it's super simple. There's also a link on my website straight to this page, and you just click that button to apply and then go through the steps. You can do it, or get a niece or nephew, grandson, neighbor, anybody who's tech savvy. If you don't think you are, they can help walk you through it.
A quick question on that, income qualifying, is that gross or take home?
I believe it's your adjusted gross income that's on your tax return.
Okay.
Adjusted gross. So that's after your expenses and stuff have been written off. Does that make sense? After they're reduced. So not gross, but adjusted gross. Also, if you live near Hahira and need my help with any of that stuff, you're always welcome to come to my office and I will help you in person. So, the second thing, if you have lower income, is Medicaid. I point out AID. This is how you remember the difference between Medicare and Medicaid. AID is for people with certain situations that need aid, like you have a lower income or you have a disability of some sort, or you have more children than you have the funds to take care of. The food stamps and the things like that for the children all falls under Medicaid. If you got Medicaid, you're restricted to using doctors in that program. But in the Medicare world, there are these dual eligible plans now that I've got access to. If you have Medicare and Medicaid, then you can get these special plans for dual eligible people, and they've got a lot of extra benefits that can help you. So if you're in that situation, talk to me. These are the qualifications for Medicaid. I'm not going to spend any time on it. It's in your folder. If you fall underneath these guidelines, then you shoot. And this speaks directly to your question, ma'am. Here are the different QMB, SLMB, all this. These are different qualifications of Medicaid. And LIS, the Extra Help Program, has a similar thing where even if you don't qualify for the whole savings, you may qualify for part of the savings. So they have different levels based on what your income is. Yep, both of those programs have that. Medicaid is a state thing. It's state by state. The Extra Help Program I talked about, that's a federal thing. So, if you need Medicaid, here's exactly where to go to get it. The gateway. So in your packet there, you go straight to this page and you click that button. And that's it. and get somebody tech savvy to help you fill out the forms if you need it. Otherwise, boom. If you live near Hayhire and want my help, come see me. Yeah. If you want to go in person, I don't recommend it, but these are the offices for your benefit that I put together along with the contact information to go in person. It's like trying to go to the DMV. It's a mess, but it is an option. Don't try to get them on the phone. It's not going to happen. Just show them in person.
And a lot of offices are locked.
A lot of offices are locked right now due to COVID and stuff like that. So the online option is going to be least. Next, if you have higher income, I covered if you have lower income. Now this is if you have higher income. If you are married and your income is over this amount, then you're going to owe a little bit more than the 170/10. You're going to owe that plus a little bit more on your prescription drug plan. You can, the restroom's down the hall to the left now if you need to do stuff. That's where you're headed. So if that applies to you, that's what to expect. If it doesn't apply to you, disregard it. So that leads us into the nuts and bolts here of your options. And this is option number one. Option number one is do nothing. That is an option. You can just take your Medicare card, your standard A and B, and because a drug plan is required, add a standalone drug plan, and then that's one way to go. So you got A and B, and you got a prescription drug plan, no other insurance other than that. And if you do that, then what you're looking at is your 170/10 out of your Social Security, and then 233-year deductible for your Part B, so your doctor bills. You got to pay that $233, and then Medicare is going to kick in and pay 80%, and you're going to pay 20%, and you're going to pay your monthly payment for your prescription drugs and your co-pays and whatever for your prescription drugs, and that's it. You can go that route. That's one way to go. I wouldn't recommend this because, as you'll see later, even the Advantage plans are $0 a month and will cover you on this 20% plus that $15.56 and all that. And so if it's $0 a month, then you might as well at least have an Advantage plan, which is also going to bundle in some other stuff. So you might as well have that. Well, this isn't an option I recommend. It doesn't make any sense to me, but people who don't know any better often end up here because they just don't know any better. They get froze up, not sure what to do, and so they don't do anything, and including sometimes not even get the drug plan, which will cost them later. They come back and try to get it, and it's like, oh, we got all this penalty and all this stuff. So I don't recommend the do nothing option. I recommend one of these other two options, and you'll see why. By the way, you will also still be on the hook for all this stuff. If you do go the do nothing route, you got all this stuff you're still on the hook for. Nothing's going to help protect you from all those other costs. So, option number two is you can get a plan of some kind, a Medicare plan. There's two basic types of Medicare plan. And of all the stuff you see on TV and all the mail and all the stuff, I'm going to make it super simple. It's really not that hard. It's criminal how complicated they're making it. It's so simple. There's only two different kind of plans. One is a supplement plan. One is an Advantage plan. Okay? The supplement plan is standard Medicare with a plan on top, and you add a standalone prescription drug plan. So that's one. Number two is the Advantage plan. Now we're going to dig into those two different types and the differences, okay? So first we're going to talk about a supplement plan. Supplement plan. So a supplement plan is called a supplement plan because it supplements your Medicare. That's why it's called a supplement plan. It supplements your original, or goes along with, or adds to or improves your original Medicare. That's why it's called a supplement plan. It's also called, another term for it is a Medigap plan. It's the same plan, it's just a different term. Why is it called a Medigap plan? Because it fills those gaps in Medicare that Medicare won't cover. So, supplement plan, Medigap plan. So, these plans are federally regulated, and they have this letter system. You know, there's these different letters that you choose from, and but really only 2 of those are relevant, and we're going to talk about that in a second. Show you the 2 that are relevant. The only difference between those plan letters is, I think somebody needs to silence their phone. The only difference between their plan letters is the cost. I want to give you an example, okay? So the only difference between your car insurance with Geico and your car insurance with Progressive is the cost. It's the same insurance. It's just who's charging you a different, what rate, right?
Yes.
It's the same thing right here, okay? It's exactly the same stuff. Humana's Plan N works exactly the same at the doctor's office and the hospital as Mutual Omaha's Plan N. The only difference is the monthly payment. Why? Because it's federally regulated. They don't get a choice how they pay out. This is Medicare paying out, and they're paying out what Medicare doesn't pay, and they don't have a choice about it. So the only difference is the price. By the way, it says that in your Medicare Renew handbook on about page 5, where it encourages you to shop your plan every year, and it says specifically in your Medicare Renew handbook by Medicare that the only difference in in any of these plans is the price. So there's all these letters in the supplement world, you know, all these plan letters, but guys, it's going to get real simple real fast. All that really matters is G and N. That's it at this point for this group. Back before this group, there was a Plan F that was relevant, but they've discontinued that plan. It's not relevant. G and N. So what's the difference now between G and N? What's the difference between G and N? The only difference between G and N is how much you pay when you go to the doctor office. Plan G has nothing you pay. The trade-off is G costs more per month. So G costs more per month, but you don't have to pay anything at all in copay when you go to the doctor's office. That's G. N costs less per month, but you have a $20 copay when you go to the doctor. That includes your specialists. So, unless you're going to the doctor 5 times a year, or more, Plan N is likely for you. If you're going to the doctor more than 5 times a year, G may start to make sense, but honestly guys, G is like $30 a month more than N. So when you consider how much more a month it is over the course of the year, you'd have to go to the doctor really about 10 times or more to get even over here. So N is also going to go up less in rate changes over time. G is going to have more rate changes, N is going to have less. There's a reason for that. I can explain to you another time. But N is going to have a more stable rate. So, what do these supplement plans cover? Back to our original chart. So, at $15.56, when you go in, it shouldn't say per year, that's a typo, it should say per visit, sorry about that. $15.56 per hospital visit, your supplement is going to pay that every time, 100%. The Advantage plan is not. The Advantage plan will not. I'll explain more when we get into the Advantage plan, but this is an important note. Every time you go, they're going to pay that. What else are they going to pay? They're going to pay all this stuff. They're going to pay all this stuff. They're going to pay that full 20%. So, in that scenario where you had a heart surgery or something, and your doctor bill was $100,000, and Medicare pays 80%, and you're on the hook for 20%, the plan pays for all of it. You do not pay another thing other than your monthly payment. And if you chose Plan N, $20 when you go to the doctor. And that is it. This plan is going to cover everything else. Everything else. A lot of people like that. The trade-off is you have a monthly payment for this plan. A, you have a monthly payment for this plan. B, this plan typically requires you to health qualify. Advantage plans don't require health qualification. They'll take anybody off the street. Supplement plans will not. But most of you are standing inside your golden window of once in a lifetime opportunity. We already talked about all that. once in a lifetime window of immunity the government gives you. So 6 months before your 65th birthday, starting then, up to 6 months after with some carriers, 3 months after with most, 6 months after with some, they can't ask you any health questions for the supplement plan. So everybody is automatically approved. This includes a lot of people who would not ordinarily be approved. So if you know you have some health issues and you would not be approved ordinarily, then this is an important decision, because you get this once in a lifetime opportunity of immunity. All right. After that, you'll have to health qualify, and it'll cost more. Next up is the Advantage Plans. This is an entirely different type of plan. It's very different from the supplement. So how many people have seen this? Does this look familiar to anybody? Yeah, Broadway Joe and Mr. Dynamite, right?
That's the one I picked.
So what's going on here? What's going on here? They're talking about includes dental, vision, hearing, prescription drug coverage, but they also talk about some other stuff, right? Meal plans, transportation, exercise, Part B give back for that Part B cost. They talk about all these things. I get calls all the time like, Chris, is this real? What's all this about? And So we're going to get into that. So Medicare Advantage, first off, I want you to understand this. When you go to an Advantage plan, you're giving up government-issued Medicare. Advantage plans are a contract where you are giving over your power to the Advantage plan, and you are stepping out of your standard A and B situation. The Advantage plans have a contract. They're saying, okay, government, we will take on this person for you. You're going to pay us some money to take him on. And we're going to handle all of his stuff from here. You're out of it, government. We're going to handle it from here. So you're giving up your A and B situation. You're going over to a managed care situation with a private insurance company. So Advantage plans are, first off, this is very important, they're local network based. Advantage plans are based on your zip code. The supplement plans are not. That supplement plan we looked at, you can go anywhere in the country you would like to go with a supplement plan. There's no network at all. Also, the supplement plan, you can go to the Mayo Clinic, Cedars-Sinai, all that stuff. Those facilities will not take an Advantage plan. You cannot go to the Mayo Clinic with an Advantage plan. You cannot go to Cedars-Sinai with an Advantage plan. You actually can't go out of your network and see a specialist with your Advantage plan. So it's network based. That's how they keep the cost down, right? You got to stay within the network of doctors and the hospital network, right? That's how they keep the cost down. It's typically $0 a month, right? It's $0 a month, and that's sweet. The difference, the way they make their money is on the co-payments and the co-insurance. So when you go to get services, you're going to have to pay a certain percentage on those services. You're going to have a copay when you go to the doctor, copay when you go to the specialist, and then if you get hospitalized, let's use that $15.56 example, okay? Remember, you have to pay $15.56 when you get hospitalized under Medicare in Part A. If you have a supplement plan, it pays all of it. If you have an Advantage plan, it pays all of it, but then it bills you back. The insurance company bills you back a nightly fee for being in the hospital. Around here, it's $300 plus. So if you're in the hospital less than 5 nights, let's say you're in the hospital 5 nights, then you still paid that $1,500 basically that you would have had to pay. So this is how they make their money back, is the co-pays. And also, Advantage plans require what's called prior authorization. So if you want to get a procedure done, like a hip surgery or knee replacement or something like that, the insurance company has to authorize it first. A supplement plan, that's not the case. With a Advantage plan, you gotta have prior authorization. And they may want you to go through some sort of step therapy first before they approve it. Like they may want you to have some sort of, go see an occupational therapist or physical therapist first before we're gonna be willing to pay for that procedure. And so that's part of how they mitigate their costs. They're not gonna just cover everything. If you have a supplement plan, your doctor and you want it, that's it. Book it, done, that's it. So Advantage plan, you don't quite have that luxury, you're gonna need prior authorization. Also, typically requires referrals for specialists. You have to go to your primary care physician to get a referral for a specialist. Supplement plan, you call the specialist office up direct, book it. Here's my supplement plan number, boom. This does not travel well, as we talked about. You typically have to stay within the network. Also, if you go overseas, supplement plan will cover you on your cruises and all that stuff if something happens to you overseas. Advantage plan, it will not. Advantage plan, there is no coverage overseas with Advantage plan. So, that said, these are a fantastic alternative to the supplement plan for folks that don't want to pay the monthly payment for a supplement plan. And they do bundle in, as it showed, the truth is they do bundle in prescription drug plans, some dental, some vision, some hearing. Now all that stuff is limited to the network as well, but they do give you some of that, which is convenient. And some plans are starting to give more Part B give back, anywhere from $50 to $100 off your Part B. So they put that back on your Social Security. So instead of that $170 that you would owe, they add that back, and that is nice, and that's good. And they're adding things like that all the time. So that's an option. So again, you get A and B together. They call this, by the way, Advantage plans are called Part C. I don't know why, it's stupid. But if you see something about Part C, it all that means is an Advantage plan. That's the category for all Advantage plans, C. So it combines your A and B, it gives you some prescriptions and then some of this stuff. And then that's the basics of the Advantage plan. If you leave market, if you decide to move somewhere else, you will have to discontinue that Advantage plan and pick up a different one in the new market, because as I said, it's local based on your zip, and you have to get something now that covers you in that new market. So they are making these more and more attractive to people. One of the things they use on the television commercial to make it attractive regarding the meal plans and the transportation, that's typically going to be reserved for folks who are on Medicaid. There are special Advantage plans for people on Medicaid, and those are called dual eligible plans, and those people can get meal plans and extra transportation benefits and things like that. Also, over-the-counter benefits, a card preloaded with a certain number of dollars that you can use towards over-the-counter costs. And now, if it's got the Visa thing built in for some carriers, and so basically anywhere that Visa is accepted, and that's really sweet. So they're adding that more and more. I've been doing the carrier trainings here this month because they're rolling out all their new 2023 stuff, soon. And so this is the time of the year where they have us all going into the carrier trainings. I'm doing another live one tomorrow for WellCare. I just did Humana's. So I'm seeing all their new stuff that's coming out, and they are continuing to build in more and more stuff to these to add benefits and include upping the dental and this and that. Yes, ma'am.
Are those additional benefits only for Medicaid people, or like any average person that would be on Medicare Advantage?
Well, both. So they're continuing to add benefits to people who are not on Medicaid, just for the general plans, and they're continuing to add more benefits for people who are on Medicaid. So this is a legitimate route. It's a legitimate route. It is more restrictive. It does have the network and so forth, but it is very affordable. Now, I always strongly encourage anybody who's going to do the Advantage route. You're paying $0 a month. You need to say, okay, well, my insurance for my health is worth at least $35 a month. Add for $35 a month an out-of-pocket protection plan, because we've seen all those co-pays and co-insurances and all that stuff that comes up. If you have an out-of-pocket protection plan added to it, then that will pay you in lump sum if you get hospitalized. It'll pay you in lump sum if you need an outpatient procedure or whatever. You then use that lump sum of money to pay the co-insurance, so you're not in the hole. and you only paying $35 a month for it or so. And so always strongly recommend that.
I have a question.
Yeah.
Does the Advantage Plans keep up with the amounts that you have for the Medicaid as far as medications, like 25% or whatever? Because I know most of the ones where I am, they're like $7 and $9 and $21.
Does Medicaid,
Medicare.
does Medicare keep
But
up?
it's an Advantage plan.
Yeah, Medicare's,
You had specific amounts under Medicare where it was 25%. I forgot what the others were for the first level.
all that still applies. Yeah, all that, including the $480 deductible. So that prescription
Depends
drug.
on what the plan is then, because they don't have to go by that. They work with Medicare, but they don't have to go by those guidelines that you were saying that Medicare would buy.
Prescription drug plans have a $480 deductible that is set by Medicare, and that is on every plan. I can show you, every policy. So you don't have to get into that $480. This is where they have the volition that you're talking about.
I'm in an HMO and I don't have the 480.
Yeah, the $480 typically does not apply, as I was saying, to any of the tier 1 or tier 2 drugs. So most of the time, people aren't getting into that $480. The drug plan does have that opportunity to do that, and most have. So they're even bumping that up now some, and into some of the lower tier 3 drugs, you're not getting into the 480. But you're right, the insurance companies do have the right to determine what's going to count towards the 480 and what isn't. They just don't.
Deductible, unless you get catastrophic, you really don't pay that much.
Yeah. For most people, Now, I will say, I did a policy for a woman this week, diabetic, and she's got a lot of the quick pen stuff, and she's got the things that help keep up with her pump. Well, it's only free. It's very expensive if she gets it through a prescription drug plan, but if she gets that stuff given to her in the doctor's office setting, then that falls under Part B. Because what does Part B cover? Doctor's offices. So there's different ways to help keep your drug costs down, but yeah, that's that. So what's the bottom line? Odds are you're going to want one of these two plans to go with your standard issued, government issued Medicare. You're going to want either a supplement plan or an Advantage plan. So here's the deal. Here's what it comes down to. This is mostly the assessment, right? If you want to go anywhere in the country for your health and services and have that option open, if you prefer no extra cost other than your monthly payment, so you know up front what you're paying, and there's no surprises later with any copays or co-insurance or anything like that, and you're good with the $20 copay, so that's all fixed, and you can afford your $170.10 a month that's coming out of Social Security no matter what, plus your Medicare Supplement Plan costs. For most of you in here turning 65, if you're a female turning 65, your plan is going to be anywhere from about $78 to $85. And if you are a male turning 65 or are 65, but inside that window I talked about, add about $10. So if you can afford that monthly payment and add a little drug plan and afford this line right here, then the Medicare Supplement Plan will likely be the choice. This is going to provide the most comprehensive coverage. You can go anywhere you want, see all the different specialists anywhere. Now, if you can't afford the above or you don't want to, then that's valid. Then that's okay. That's why the Advantage plans exist. And you don't mind the network approach. You're cool, okay, well my doctors are around here. I'm happy with my doctors around here. That's fine, no problem. I can't go to the Mayo Clinic, who cares? I'm sure there's a specialist nearby that can meet my needs. You're okay with the out-of-pocket costs and co-insurance as you use the plan. Again, I recommend putting in the out-of-pocket protection plan if you feel a little more comfortable. Like, well, if those things come up, I know I got a plan Chris helped me with. It's going to pay me lump sum to take care of those things, so I'm good there. And you like the aspect of having everything bundled together, plus some extra perks, maybe the over-the-counter card, and all that. Or you're also on Medicaid, in which case they have these special Advantage plans, as we talked about. You can get even more benefits through the dual eligible plans. So if this is you, then it's the Advantage route, and it comes down to that, and it's typically this right here. It's either can I afford or do I want to afford the monthly payment for a supplement plan, which will go up a little bit over time. Or do I not want that, but understand there's restrictions here, and I'm cool with the restrictions, and then this is cool. So that's what it comes down to right there. So important dates for getting in either one of these plans is this. If you're going the supplement route, then they will allow you to put your application in for a supplement plan 6 months before your birthday. I highly recommend doing that. Why? Well, it locks in the rate of 6 months before your birthday. That when your actual birthday comes, the rate could be higher. So if you can get an earlier rate, then why not? So also, remember, you don't have any Medicare, you don't have any health questions. So it's a very quick, easy application, boom, boom, boom. And you don't need your Medicare number for this one. They'll backfill that once you get onto Medicare. They got a whole system with Medicare, and they'll add that in later. And so that's that. Then 3 months later, you'll add the prescription drug plan application. The prescription drug plans do require you to have your Medicare number in order to submit that application. But typically the way I do it with my supplement people is we go ahead and bust this out, do that MedSup app, we set an appointment on the calendar for 3 months later, and then I submit that app. Boom, done. If you're going the Advantage route, it's a 3-month thing. You do have to have your Medicare number in order to have a Advantage application submitted. And you don't need a separate application for drugs on this one because that's included as part of your drug plan. Now, if you're over 65 and you are on an Advantage plan, then you need to have that plan shopped every year. I'll do that for you for free because, as I said, every year new Advantage plans are entering the market. There's plans entering the market right now that are better for some people than the plan they've got, and they don't know any better, and so they stick on the plan they've got when they could be having this extra $150 over-the-counter card, or they could be having $3,000 in dental benefit instead of the $1,000 their current Advantage plan has. But they just don't know any better, so they sit tight. I shop your plan for you every year. If you're on an Advantage plan and you're over 65, then during your annual enrollment period, which is going to be my next slide, you want to get with me and have me just do a quick review for you. Hey Chris, is there anything better for me than what I got right now? And if there's not, cool. If there is, let's take a look at changing it. It's super easy to change, and that's that. So, I already talked about that. If you already have an Advantage plan, this is your annual enrollment period. It starts October the 15th. That's coming up. But I can actually start doing the research for you on October the 1st. That's what Medicare guidelines are. I cannot talk to you about it until October the 1st. But starting October the 1st, I can price it for you. On October the 15th is when the first date I can actually submit the application for you. So, I highly recommend having me do that. Some of these also may have to, some of these I just looked at, by the way, coming out this year, they have lower copays for visiting the doctor than the current plans. So instead of a $40 copay when you go to the specialist, it's a $15, $20. So if you're on an Advantage plan, shop it with me because you may save money over the year with just switching plans. Don't call people on the 800 number. Call Chris. I know these plans better than the people on the 800 number. So, annual election period, talked about that. So one thing to remember, this is very important, guys. If you're on a supplement plan and you end up going the supplement route, that annual election period never applies to you. You can change supplement plans any time of the year. The annual enrollment period is only for people on Advantage plans who want to take a look at changing Advantage plans, or with a prescription drug plan standalone that want to take a look at changing their prescription drug plan. But not for the supplement plan. You can change supplement plans any time of year. All right. There is a special period, January 1st to March 31st. If you're unhappy with your Advantage plan and you want to go back to original Medicare or get a supplement, then you can do that during this, what I call unhappy with Advantage plan period. They call it the annual disenrollment period. But this is what it is. If you're unhappy with your Advantage plan, you can get out during that period right there, switch, or go back to Medicare. So, last things you should consider here, cancer plan. The thing that really tears people up with cancer is the medications. They're like $8,000 for a handful of pills. And even in the catastrophic phase, as this woman was talking about, you're responsible for 5% of the cost of the drugs. Even then, there's never a cap on prescription drug cost. So 5% of $8,000 pills that you have to take a lot of can add up very, very quickly. A cancer plan pays you a lump sum of money upon the diagnosis of cancer. You then use that money to help pay your prescription drug plans, or if you had an Advantage plan and you want to go see someone at the Mayo Clinic or somewhere else and the Advantage plan isn't going to cover you, you take your lump sum of cash and you go see anybody you want to. Or if it's terminal and you don't have any hope for yourself, then you can take the money and go on a cruise. You know, whatever you want to do, it's your lump sum of money to do with. Yes?
That's a one-time payout.
It is a one-time payout, but there is a recurrence rider that you can put in that will pay you out again after 5 years. If you have 5 years cancer-free, then you can add that rider, it'll pay you again. Otherwise, people will add the heart attack and stroke rider to that as well. Same situation. If you have a heart attack or a stroke, you're diagnosed with that, you get a lump sum of money. You can use that to help pay for at-home care and so forth. Medicare is not going to pay for that. They'll pay for, you know, medically administered things at home and medically things. But if you want like just a personal caretaker to help you and stuff like that, like I had for Mima, then you have to pay for that out of your pocket. That plan right there is fantastic and pays you lump sum. Dental, vision, and hearing. If you go the supplement route, you're going to need to add on dental, vision, and hearing. Medicare doesn't provide it, so you add on a little dental, vision, and hearing. The plan I have has all three: no 10, no network, go anywhere you like. About $24 a month right there. Long-term care, life insurance. Last thing is annuities. If you got a lump sum of money in a 401k because you worked, that 401k is subject to the stock market right now and its ebbs and flows. Most people at this point in their life want to get it out of there and into something more stable. An annuity is exactly like a CD. So it pays you a fixed rate and then there's no risk. That's it. So the rate that it pays based on this right here is 2 years, 3.5%. Compare that to what you're getting in your savings account right now. That is a ton. So you put it in a 2-year CD, you can still get it 10% of the money, even while it's in this. And once it's up, you can roll it back into another one, or you can not. It's up to you. But this is a lot better than what you can get inside a CD or what you're getting in your 401k right now. And so highly recommend that. Otherwise, it's dormant money. Given the inflation that's happening right now, money that you have in a savings account or some other thing that's not earning good interest is losing its value. Losing its value. So see me about that if that's something you'd like to speak about. So what now? If you're within 6 months of your 65th birthday, we need to talk. We can submit your application for your supplement plan, and I recommend we do. If you're 65 or older and a current plan, we need to talk because I need to review your plan with you and see if there's something better for you. And we need to maybe add one of these. Lastly, give me 1 second, right? Give me 1 second. Lastly is, well, why would you talk to me at all about any of this stuff? Why me? Well, here's the deal. Most of you are likely going to want someone to help you enroll in a plan. One of those two types. I think it should be me. Why? Well, because why call an 800 number and deal with an out-of-state stranger when I'm here and I'm accountable to you? Try calling the 800 number and getting the same person on the phone twice.
Hello.
That's not going to happen. You know where to reach me. You can reach me anytime. You can drive over to Ahar and see me in my office. Rates with me are the same with the carrier. Plus, I can move you, and they can. If you get with United Healthcare and you decide they've raised their rates too much and you don't want to be with them anymore, they cannot move you. You'd have to call up another carrier, and why do all that? I'm contracted with all the carriers, it's the same rate. Local, I said easy to find. I invest in this community, support all kinds of stuff in the community. When invest with me, it gets reinvested into the community. And lastly, because hopefully after this presentation, because you like me and you trust me a little bit and think that I know enough to be able to help you. So you've already filled out the contact form. What we're going to do now is we're going to get the food served, and there's an opportunity now to book an appointment with me if you would like to schedule an appointment. Jasmine, my helper, and myself will come around. We'll have my calendar open on the phone, and we'll just book in a time for you that's convenient to talk about your situation if you'd like to do that. If you don't want to do that, that's okay. You can do that at a later time, but you might as well. I do 4 of these a month, and as you can probably tell, the schedule gets full. So you might as well book a spot now, and we'll get you squared away. So
Awesome.
hope you enjoyed the presentation.
Thank you.
Go ahead.
Hi, I hope you enjoyed that webinar. If you would like help with your particular Medicare situation and to know your best options, get help with your rates and so forth, reach out to me, 229-740-6262, or you can email me, chris@yourlifeagency.com. I encourage you to do that. I'd love to help you and make sure you're on the right track. Look forward to hearing from you.